Welcome back to Community Roundup. The US Surgeon General Dr. Vivek Murthy is the youngest person of Indian origin to hold the Surgeon General badge of the United States. इन्होंने recently Austin में public health को लेकर अपने views share किए.
The US Surgeon General Dr. Vivek Murthy recently visited Austin. He met community leaders and healthcare professionals at the Seton Healthcare Administrative Office. Indian American Coalition of Texas ने एक खास इवेंट ऑर्गेनाइज कर US Surgeon General Dr. Vivek Murthy के साथ इंटरेक्ट करने की अपॉर्चुनिटी दी.
I'm delighted that he was selected, nominated, and approved by the US Senate. I am happy to see that first we have a great physician as our Surgeon General, that the commission officers of the U.S. Public Health Service have a great leader who has public health as his priority. And I'm delighted that the Indian American Coalition of Texas invited him to Austin.
Vivek Murthy is youngest person and first person of Indian origin to hold this post. तो साथ ही डॉक्टर विवेक किस पर ज्यादा अटेंशन देते हैं इस बारे में भी लोगों के व्यूज जानने का मौका मिला.
It's very important. I think first and foremost, him being an Indian American physician is really great for us, great for the Indian American and physician community to have such a prominent position. I think the focus on preventative health care is an important one, something that we need to pay more attention to in terms of the changing dynamics of healthcare cost. I think prevention is a real key to that, and I think it's important that we have a voice that can really clearly and eloquently speak about that and help to bring that message across to everyone.
As a hospital, we have had traditionally success, but as we look at how we take care of people in the future, we recognize that care has to be outside of the hospital. And as hospitals, we've done really good in taking care of sick people, but health is not about taking care of sick people. It's actually prevention. So his mission, what he's out to do, and what we have to do correspond very, very well. And we feel honored to be part of this work and this journey. And as a system, as a hospital, as well as Ascension, we focus on prevention as well as wellness of the person.
Dr. Murthy focusing on the issue of prevention and health promotion as the backbone of our communities. तभी तो यहाँ पर मौजूद सभी ने public health care पर ध्यान दिया.
The first thing that struck me was that he talked about equity in healthcare, and we're all about equity in education. And if you remember that IAC speech that I gave, we talked about coming to school to help not only Indians but also kids of every ethnicity. And that's exactly what he said, providing health care for everybody, not just for Indians or Indian Americans. So I really think it's just different fields, but the idea is the same. And it's great that he is a leader of a community. He's the leader of our community, and it kind of gets Indian Americans out there. And like I said, we are in a position to effect change, and I think we should use our power to effect change.
I think prevention is key. So obviously heart disease is still America's #1 killer. And although the mortality of heart disease peaked in 2000, over the last 15, 16 years, less and less people are dying of heart disease. But unfortunately, it still remains America's #1 killer. And when we factor in that about 80% of heart disease is preventable, I think prevention is key. So his message of staying active, being proactive, getting screened, I think is really the keys to long-term success for prevention of heart disease.
इस दौरान डॉक्टर विवेक मूर्ति के साथ भी टीवी एशिया ने खास बातचीत की और जाना कि यूएस में पब्लिक हेल्थ चैलेंजेस पर अपने क्या थॉट्स है.
Well, the big challenge we have in the United States is that we focus the majority of our time and effort on figuring out how to treat illnesses and not nearly enough on figuring out how to prevent them. And we have to shift that. We have to create a culture of prevention in America. And to do that, it's not going to be easy because we have to change how we approach health. We have to make sure that physical activity and the good nutrition and emotional well-being are the cornerstones of our communities, and make sure that we are supporting and promoting behaviors that ultimately prevent illness. And if we can do that, if we can build that culture of prevention in America, then I believe that we can alleviate death, suffering, and save ourselves healthcare costs along the way.
ISCT hopes to educate, engage, and empower the Indian American community about issues related to political and civic engagement. Through various resources, programs, and initiatives, ISCT strives to provide a voice of Indian Americans to the Austin and Central Texas community.